courage takes many forms, and I hope we all heed your call to find even more courage than we've ever drawn up before. In the current environment, it is courageous to tell the truth. And an important element in all of what we're talking about is finding out what that truth is. An important part of making progress, of fighting back against bad things, is exposing what the bad things are and who is supporting it. Journalism plays a key role in keeping us informed, in speaking truth to power, and exposing wrongdoing, keeping policymakers honest. So I'd like to introduce our next segment and our next panelist, Julie Appleby. Many of us got to know and appreciate Julie's work as a journalist from her time at USA Today before joining KFF Health News. She has been reporting on healthcare issues for many years. She understands the policies, is familiar with the key groups in healthcare, and can thoroughly examine and precisely present the impacts of policies on beneficiaries. Help me in welcoming Julie to the stage.
Thank you for that lovely introduction. Yes, I've been asked to come here today and talk to you just a little bit about how reporters do their jobs. You know, what do we do all day up there? You know, because there's differences depending on the person, the outlet, the area they cover. I'm going to mainly focus on what I do as a health policy reporter at KFF Health News. So as David mentioned, KFF Health News is a national nonprofit newsroom that does in-depth journalism on health policy topics. Our stories run in outlets around the country. So from a little paper in North Dakota to the New York Times to NPR to a variety of things in between. I write about a variety of health policy related stories. You know, what's going on with the ACA, what's going on with the individual marketplace, employer coverage. We do a bill of the month feature you may have seen. We write about Medicare, Medicaid, et cetera. So that's our area of coverage. And at the outset, let me just say that it's my belief that no matter what their beat, every journalist's primary role is to provide information as objectively as possible, not to advocate for any particular cause. So in my view, the reading or viewing public decides what, if anything, to do with that information. So that said, let me just give you a little sort of like Reporter 101. How do reporters work? How, for example, do I come up with stories? So there's lots of ways that happens. So clearly, some are news-driven. A House committee, for example, drops a budget plan, or there's a proposed regulation concerning the Affordable Care Act. So we take a look at that. What's in it? What's going to happen? What do the experts think? What do real people think? How will it affect people? Some stories are editor-driven. They come up with an idea and assign it to a reporter. These are also often based on some kind of a news event that's happening. But most story ideas are generated by the reporters themselves. So how do we do that? I read widely. I try to read journals. I try to read other news outlets. I read policy papers. I read regulations, so you don't have to. I get a lot of emails. I probably get dozens of emails every day, and frankly, I don't read them all because I get too many, and many of them are completely unrelated to what I cover. I had a funny one the other day I was going to tell you about it. The subject line was, how to fix a flat butt without intense workouts. Well, that's not really something KFF Health News is going to cover, but thank you. Anyway, delete. So, but one of the main ways that I come up with story ideas is I keep in touch with the sources I've developed over the years. I check in with them every now and then and see what they're hearing because they're the ones that are out there. They know what's going on. These are experts who are actual people on the ground in the area that I cover. So it might be public health folks during a pandemic or researchers who study a topic or a disease or a policy area. Hospitals, insurance executives, advocacy groups, regulators, lawyers who follow health law, employers who pay the bills, and yes, most importantly, real people who are affected by policies or situations or conditions. Sometimes people reach out to me. So like last year, for example, I got an email from a reader who was flummoxed by this tax bill for an Affordable Care Act plan that he'd never known he had. He was enrolled by a broker he'd never met in a state far from where he lived. That same week, I got another email, this one from a broker in another state, that detailed how he had lost hundreds of clients to rivals who were stealing his clients for the commissions. And I thought, wow, this is weird. Is it two one-offs, or is there something more going on here? Both of them had reached out to me because they had read earlier stories I had done that touched on the topic of Affordable Care Act in general. So I started calling some of my sources that I've developed over the years, talking to insurance agents around the country. Were they seeing this? And I kind of learned the problem was a little more widespread than had been revealed in the past or that federal regulators initially wanted to admit. So I ended up writing quite a few stories last year about people who were enrolled or switched in their Affordable Care Act plans without their express permission. So that's just one. Those are a variety of ways that reporters get ideas. So what's the process? So I'm going to try to talk with as many people as possible when I'm working on a story. They're not all going to get in my story because they have to be kept to like 1,000 or 1,200 words these days because stories are getting shorter. And it's actually much harder to write shorter than longer. I learned that at USA Today because we were all about short stories. But it's hard because you can't include every single thing. So I talk to a lot of folks. I write the stories. Once stories are done, they don't just automatically get posted. So instead, at KFF Health News and many other outlets, there's a rigorous process that we go through. So first, my editor reads the stories, a draft. She's an excellent editor, and she often has questions or has really good suggestions about, let's move this around, let's do that. I may have not written something as clearly as it could be. Maybe I've confused her. If I'm confusing my editor, I'm going to be confusing my readers. So we work on that. After the initial draft is satisfied, a second editor reads that story, and they may also have questions. Once those editors are satisfied, the story goes through another review. This time it's the copy desk, and they do another round of fact-checking. So many, many times during my career, the copy desk has saved me from myself finding a name I've misspelled, or a key word left out of a sentence, or a math error. So they've saved my butt on a number of occasions. So editors and copy editors then write the headlines generally, sometimes with input from me and sometimes not. So that's kind of like the day-to-day process. So as I mentioned, I get a lot of emails. I delete a lot of them. Let me just tell you a few things I appreciate about sources. If you're a source, what do I appreciate? I appreciate a source that gets back to me quickly because a lot of times I am on deadline. I strongly prefer on-the-record conversations, and most of my sources, we talk on the record. But that's not to say there's not a time when you can talk off the record. So what does that mean? What is on the record, off the record? And every reporter has perhaps a slightly different definition of that. So I would strongly encourage people, if you're going to be talking with reporters, to find out up front what does that mean to them. For me, off the record means that I am not going to use that information at all. I will not use that information in print or reporting unless I can get it confirmed and attributed elsewhere. The off-the-record person's name is not associated with that information. On background is another term that sometimes reporters use. For me, that means I can use the information but not attribute it to the person that I'm speaking with. I still have to confirm that information elsewhere, obviously. Other reporters may have differing definitions. So anonymous sources are also another topic. We at KFF Health News generally do not use anonymous sources. However, there are exceptions, such as when a person fears disclosing their identity will make them unsafe, or fear for their job or their families or political repercussions. In those cases, I need to get approval from my editor and the top editor in order to use an anonymous source. It may work differently at other news outlets. People often ask me, can they read my entire story before publication? And the answer is always no. That said, I will circle back with an individual if I'm quoting, if I have any question about what they said, or I want to double check a complex fact, say an intricate policy detail, or a portion of a lawsuit, or a scientific finding, just to make sure it's stated accurately. So it'll be that portion of the story, not the entire story. So kind of to wrap up, and then I want to take some questions. I'm going to leave a little bit of time for questions. So the sources I find myself returning to over and over are those who are honest about what they know. If they don't have an answer, they say so. They don't exaggerate. They can help me point me to source documents where I can get more information, public records, other places like that. Some help me find real people affected by the problems, and this is really important because reporters are always looking to show what does this policy or effect have on real people in the world. It can be hard to find people who want to talk on the record about their situation, but it's always helpful when they will. And finally, I do get a lot of emails. The ones that really catch my eye are generally to the point, and they explain why a particular idea is timely, why it fits my beat, and what information that they have that can help me with that story. So anyway, I hope that helps shed a little bit of light just on kind of what the day-to-day life is of a reporter, but I wanted to leave some time for questions, so I think Jeff or somebody had a microphone.
Yes.
And if you wanted to see if anybody had any questions specifically.
Thank you so much, Julie. We can start right here.
My name is Morris Klein. How has AI affected your work?
Right now, I can't say AI has affected my work. I do get, I haven't seen it. I Google things too, and I get the little AI thing. But right now, AI is not writing my stories for me.
Thank you. Matt, can I check in with my colleague Matt for any online questions?
Sure. When there are constant updates and threats to healthcare occurring at such a rapid, relentless pace, how can we break through that noise to get coverage of an issue?
That's a very good question because there is a lot of noise and there's a lot of stuff happening right now. I think, like I was saying, when you have an idea, when there's an issue, when there's a topic, reporters are under this tremendous pressure, this daily deadline, this constant flow of news, constant emails. So the clearer and to the point your communications are with that reporter, that's helpful. Have a subject line that really spells out exactly what it is you're writing about or you're concerned about, your issue. I think another key point is to, if you can, know the outlets that you're talking with. Who is the reporter that covers the area that you are interested in at that news outlet? Again, I go back to that email about the, fixing the flat butt. That is not what we cover. So who covers that? Where would you find that person? So that's, do a little research ahead of time and try to do that. And yes, there's a lot of news out there, and not everything is going to get picked up.
Thank you. Okay, let's hear from Harry Tang, our friend Harry Tang.
Thanks. I have a question. Right now, we're dealing with a lot of false information that's spread by powerful entities, and how do we battle that when they have so much of a voice and or dominate the media? What do we do?
There is a lot of misinformation out there. I think the thing that people can do is turn to trusted news outlets and teach people what are trusted news outlets and how to figure out if something is real or not. It's an educational process. So I think that's the key, is to educate people about where you can check, is this true? How do we know it? Where are the source documents? How do you look it up? How would a reporter think about this? How good are their sources? Where are they sources? Does it sound too good to be true? It might be true. It might not be true. So that's a hard question to answer, but I think a lot of it just comes down to trying to educate people. How does journalism work? Where do you find trusted sources? What are they?
Thank you, Julie. I think we have to pause the questions for now, but we appreciate you tremendously.
Thank you for having me.